Crossing over to Kwale County, where the governor, Salim Mvurya, is joining me live from there. Kwale, remember, is one of the hotspots for coronavirus. There's been Kwale, Kilifi, and Mombasa. We want to find out from the governor how prepared they are. Governor, thank you so much for making time for Citizen TV. So you have 4 sub-counties in Kwale. How prepared is Kwale County to handle COVID-19, especially in the health facilities?
Thank you very much, Trevor. I just want to say that Kwale County, just like any other county in Kenya, coronavirus was not predicted. But when we realized that in the country already we have cases happening, we first of all set out isolation centers. We set up an isolation center in Kwale Hospital, in Msambweni Hospital, which is our referral facility, in Lungalunga Hospital and Kinango Hospital. So initially we set up 2 isolation facilities. And then as we went along and looking at the statistics, we were able also to set up other areas. We assessed our Kenya Medical Training College. We have 2 of them here. We have Msambweni and Matuga. And these are also areas that we set them up just in case. And then we were able also to sensitize all our health workers, the public health officers, the clinical officers, the doctors, and we quickly set up a team, the team which is responsible for managing and coordinating the response.
Yeah.
And therefore, we have really been moving around to do sensitization of our communities, especially embracing hand washing and making sure that there is social distancing.
Governor, we will come to the sensitization of the people in just a bit. Governor, we'll come to sensitization of the people in just a bit, but I'm more curious of how much have you put aside as a county to deal with COVID-19?
Yeah. Normally the health program itself in the county, we have a budget of around 1.4, which is for existing programs. So when we first had these cases, then now we are able to use the same resources to respond. And these are resources which support the health workers, which also support in medication and other operational activities.
All right.
And as we went along, we also realized...
Yes, go ahead.
We also realized we needed much more, because in the vote heads that we had put, there were some facilities that we could not purchase, like the ventilators and the PPE. So these are the areas that we have been working with national government to see the amount of support that we can get from the national level.
So as it stands, how many PPEs do you have?
Right now, we are able to receive the PPEs that we received as part of the support. We received 40 initially, and right now we are also procuring more because, again, of the severity of the cases.
All right. So what are you doing right now to cushion the people of Kwale County? Because there's a chance that most people are not working right now. The tourism industry is not doing so well. Most of the hotels have been closed. Are you going to give them relief food at some point?
Actually, we have been looking at a raft of measures to cushion our people economically. And what we have done right now is we have suspended charges for various facilities. For example, all the outpatient charges in our hospitals, in our dispensaries, we've already suspended them for 60 days. We have also suspended charges for matatus. We are not charging them for the next 60 days. We are also not charging parking fees for tuk-tuks and boda bodas. We are also not charging the agricultural produce cess. We are also not charging the daily parking fees for private vehicles. We've also waived penalties and interest for business permits, and we have also suspended market entry charges and on market stalls charges. We've waived all those for the next 60 days so that we are able to make sure that people can be able to survive at this level. And we continue reviewing. One of the areas that we are reviewing is to see in the future the area of food insecurity so that we are able to support vulnerable families. In terms of also on the ground, we've streamlined our program. So right now we've purchased 100 tons of maize seeds that is going to support our farmers for free. And we also have 44 tractors that I have directed to do free plowing for our farmers on the ground as we continue to manage this particular pandemic.
But Governor, is there an actual plan of giving them food, relief food maybe from the county? Do you have you set aside the budget for that?
What we are doing now is we are now doing the actual assessment. And of course, I want to confirm that we have plans to do that. But what we have advised our field teams is to quickly do an assessment of the extent of vulnerability and the numbers so that then we can be able to procure food that would be enough for the vulnerable communities. We have also been in touch with the national government, the Ministry of Devolution, so that whatever we are not able to do, then we can also cushion through partnership with the national government.
All right, Governor, let's talk about sensitization of the people. Yours is a county where a person was beaten to death in Kibundani area for being suspected to have the COVID-19. What is the plan to sensitize people, especially in their own language, that they understand that there's no need for stigmatization?
First of all, I want to clarify that the case in Kibundani, that kind of assault was not necessarily related to corona symptoms. I think it was misreported. But in terms of sensitization, what we are doing is we are moving around the wards and villages with our teams, the public health, the social workers, the assistant chiefs, the chiefs. They are all moving as a team to sensitize people on the issue of social distancing and hand washing. And of course, in these forums, we also carry the sanitizers and soap so that in some areas this is also being distributed to wananchi. And for the traders, the ones with shops and other businesses, when you move around most of our small towns now, you will find outside the shop or the business, you will find they have a bucket with running water and soap. So this is what we are also doing in all the villages in the county.
But Governor, that is not necessarily true, especially for places like Kinango and Lungalunga, where there's really no running water and the people there can't afford sanitizers. What is the option the county government is looking at?
I think in the areas of the entire county, one of the things we have been doing is to improve water services, and even in Lungalunga and Kinango. We have also pipelines and facilities that support our people. And of course, the domestic sensitization is also happening. So even though in some areas there's a challenge of piped water, we have other options in those areas that we have done as county government, because those are areas we've also done integrated dams which are supplying clean water to our people. So even in those areas, the sensitization is happening, and we are supporting the communities also with water through water boozers and other resources that we have in the county government. So we have standing boozers that also move around to strategic locations in the areas that we don't have water nearby.
Governor, can you confidently say that in all the 4 sub-counties there's water supply, sufficient water supply?
I can confidently say that in the 4 sub-counties we have water supplies. Of course, there are some areas with a challenge, which is also a normal happening in counties. But as I said earlier, in some of those areas we have mapped, and we also station our water boozers to be able to support communities. We also support the facilities with the water boozers. They have storage facilities. So I can confidently say that we are serving the people with clean water. But of course, there are areas that are challenging, and we are considering also giving more support to those areas.
All right. Governor, you're the chairman of COVID-19 Response Committee in Kwale County. You've seen now that the disease is sort of spreading to the medics as well who are involved. What is the plan for the medics in Kwale to ensure that they are also cushioned from COVID-19?
I think the plan we have for the medics in Kwale is, first of all, to make sure that we acquire more personal protective equipment. And I've already approved the 3.2 million to be able to procure more protective equipment for our people. And the medical personnel are very critical to us, and therefore I want to confirm that we'll be able to support them with the personal protective equipment, so that as they serve the patients, as they do the testing, they are also able to be protected personally.
All right. And also you are very close to Tanzania through the Lunga border. Is there any special plans there to ensure that there's no cross-border transmission of the disease?
The border, first of all, we welcome the closure of the border with Tanzania. And what we've done to make sure that we enforce the closure is that we have put our surveillance teams, our security teams in Lunga, led by the security personnel, are doing patrols along the, not just at the border point, but even in other areas where people can like use informal routes to get into Tanzania or to get into Kenya. So we have strengthened patrols and surveillance in those areas, and we've also sensitized the wananchi in those areas to be able to tell us if there are people who are crossing illegally to this place.
All right, so Governor, the national government has directed all counties to have at least 20 schools to serve as isolation wings. Have you complied at this particular moment? Okay, this directive came this week, and therefore what we are doing is before we confirm a facility to be an isolation facility or a quarantine facility, it has to be assessed to meet the basic standards. So yesterday we were able to send our teams, and we should be able to receive the reports specifically for schools. Otherwise, as a county government, we had already identified the Kenya Medical Training College in Msambweni and the Kenya Medical Training College in Matuga to be part of the quarantine facilities, which we have already assessed and approved, and we've already equipped them for that particular purpose. And those facilities can accommodate around 40 people when required. All right. So, Governor,
the schools, we are now doing the assessment.
All right. You had mentioned earlier on that you're trying to cushion your people by lifting the levies and the taxes, but we know that more than 10 hotels have closed in Kwale, and mostly that then means most of your residents are now jobless. What is the plan going forward as a county?
Yes. Okay, the measures that I mentioned is basically as a startup, but now with the layoffs that we are seeing, not just in the hotels, but in many other businesses, we are also meeting to see if we can be able to come up with other raft of measures to make sure that we are able to address the challenges that arise from this process. So the ones that I have announced yesterday, I know they are not enough, but we are also reviewing to come up with other measures to help our people to be able to survive in this particular situation.
Yeah, just to clarify, Governor, is there a special fund that you've put aside? Because I remember you mentioned 1.4, but you didn't say whether it was $1 billion or $1 million, and that was mostly for the entire health sector. Is there a special fund put aside for COVID-19?
Right now, we haven't put a special fund, but as I said earlier, because we already had an existing budget in our health department, we've been able to modify some of the operational expenditures to take care of immediate requirements to contain COVID-19. For example, the purchase of the PPEs, the personal protective equipment, the purchase of sanitizers, and many other basic facilities, including medicine. These are some of the areas that we are already doing with the existing resources. And then the area of sensitization, we are also looking at other departments within county government to be able to support those kind of processes. You also agree with me that this pandemic came in the middle of already existing implementation processes. So we had to basically streamline our operations so that we are able to do a quick response to this particular pandemic. Otherwise, we haven't right now set up a fund or an account where we can be able to say this is fund meant for only coronavirus response. But we are responding with existing resources and, of course, with partnership from development partners and the national government.
Is there a possibility of redirecting some of the funds, Governor, some of the things that you already put in plan? Can you redirect the funds into COVID-19 because this is a pandemic that was unforeseen?
Yes, definitely. As I mentioned earlier, it will require that we review our budgets and programs so that we are able to address the emerging challenges and trends caused by this particular pandemic. Like even the issues I mentioned about reviewing the priorities of our people and looking at how we can be able to cushion them from unemployment. This will definitely require reviewing our budgets and programs to make provisions for these particular specific priorities.
All right. So what is your message to the people of Kwale right now as we speak, Governor? Because most of them know it's a hot spot. They are most likely scared. What is your message to them right now?
I think my message to them has been very consistent that coronavirus is real. Coronavirus is here with us, and therefore we need to make sure that we adhere to the guidelines, to the measures and directives that have been outlined by the national government and the county government. We make sure that we embrace hand washing. We make sure that we observe social distancing. And report any suspected cases to the authorities so that we are able to handle them.
All right.
So my message is let us adhere to the measures and directives that have been outlined by government.
So as a county government, what kind of support do you need right now?
I think as a county government, we need a lot of support to first of all, to manage the treatment, support with the ventilators because those are very key in the treatment process. And also, we are also looking at even hiring more health workers as a county government. And we know that the national government has announced additional recruitments, which we also welcome. So additional health workers would be very crucial. So as a county government, I also want to confirm we'll be hiring 34 new health workers. And we also expect the additions from the national government, which will be very critical to manage the pandemic.
All right, what is the deficit right now that you say you're hiring 34 new health workers and maybe also some from the national government? What is the deficit right now in Kwale? How many more do you need?
I think for us to be able to manage this effectively, we need quite a lot more, especially the public health officers. If you combine the requirement, maybe we'll be talking about figures of around 150 to be able to cover all the areas that we require to cover effectively in the communities and in our hospitals.
All right. And Governor, finally, right now as we speak, have you let your county workers work from home? What is the plan from there? Because I see you're in the office. So what about the rest of the people? Are they working? Are they joining you working from home? What's the plan for county government staff?
We've already advised our people to work from home. Okay, we only have those in very crucial services, but also very few. So most of them are already working from home, and we've advised them to maintain the issues of social distance where they are, so that they are also able to protect themselves and their families.
All right. Salim Mvurya, Governor Kwale, thank you so much for making time for Daybreak this morning. We're speaking to Salim Mvurya, who is the governor for Kwale. He's saying that they're going to hire more than 34 new health workers, and they haven't put aside special funds for COVID-19, but it's work in progress, all right?